welcome all of you in this unique learning channel called as Dedicated Nurse Educator. So today's our topic of discussion is pulse oximeter. So all of you and I is aware of we are suffering from the COVID-19 pandemic, and in this situation all are conscious about our health. So we are taking the proper measures to not to get infected with this COVID-19. So for that purpose we are doing the proper hand washing, we are taking the steam, we are taking the proper diet, and so many care is taken by us. But to monitor our vital signs in our body, one of the important equipment is there, that is called as pulse oximeter. So pulse oximeter measures the pressure of oxygen in our body. Normal reading of the oxygen saturation is 95% to 100%. Below 95, like 94, 93, 90, it may be due to some of the exertion, maybe running, maybe walking the stair, etc. But if the saturation goes below 90 or below 80, then the condition is critical. In this condition, we may require the additional support of the oxygen. It may be in the form of the nasal cannula, it may be in the form of the oxygen mask, etc. And that patient we have to transmit as early as possible into the hospital. So before beginning to this discussion, first we should know about the history of the pulse oximeter. So in 1935, German physician called as Dr. Karl Matz, he has developed the first two wavelength ear oxygen saturation meter with the red and green filters. The oxygen saturation goes down in many situations, not only in this due to corona, but many conditions can cause less oxygen saturation, like laryngitis is there, pharyngitis is there, then pneumonitis is there, then after that asthmatic patient. So any infection into the lungs can cause the low level of the O2 in the blood. In this COVID-19 pandemic, what happens? Due to the infection by this coronavirus into the lung, there is a formation of the inflammation into the lung, and there is a production of the more mucus inside the lung. Plus it will get the swelling inside the lung, and due to that exchange is hampered, and because of this the oxygen saturation goes down. Now again important point, how this pulse oximeter works. So this pulse oximeter works on the basis of the light reflection by the RBCs. Now who carries the oxygen in our body? So oxygen is carried out by the hemoglobin, and hemoglobin is situated in the red blood cell. So working of this pulse oximeter is through from the nail bed. It gets the reflection of the light from the nail bed, and it gives the reading. Now, how to use this pulse oximeter, that I will demonstrate within 2 minutes. So this is an pulse oximeter. It has a switch. Then now the another important question, where we have to actually or ideally attach this pulse oximeter. So answer to this question is, we have to see the which one is the dominant hand. Now some people are lefty, some people are righty. So in this condition we have to select a dominant hand. My dominant hand is a right one, and in this right hand we have the 5 fingers. So this is the thumb. So pulse oximeter should not be attached to the thumb, because thumb has its own blood supply. Then this is the index finger, middle finger, and ring finger. So the ideal place to attach this pulse oximeter is a index finger. So like this way we have to open this knob, and we have to put the finger properly inside the pulse oximeter. Now ideal time to take the reading is around 30 to 60 seconds. So in this you can see that two readings came, the SpO2 and another one is heart rate. So SpO2 is a 96 and heart rate is 84 or 82. Like this way you will get the reading about the oxygen saturation and the pulse rate. So the normal oxygen saturation is above 95 to 95%, and the accuracy of this device. Now mostly the accuracy of this device is depend on where you attach this device. Like I told you, you select dominant hand. From that dominant hand, you select index finger. Now the finger or hand should be stable while attaching this pulse oximeter. So it should not do the movement. Our hand should not do the movement while taking the reading. So we will get the appropriate reading. So if you come to know with the point with the accuracy of this pulse oximeter, so accuracy is around plus or minus 2%. Suppose for example I am having the O2 saturation around 96. So 94 to 98 is my actual reading in between. And if the saturation goes down, so like that way you have to calculate. So that is the accuracy of the pulse oximeter. Actually, how this pulse oximeter takes the reading? It takes the reading from the reflection of the light under the nail bed, and this RBC carries the oxygen. So on the basis of that redness, it captures the reading and it provides the immediate result. So delimitation of the pulse oximeter, number one, it does not give the values for the other blood components like the level of the carbon dioxide in the body or bicarbonate level, and some values we get from the arterial blood gas ABG that will be not provided by this pulse oximetry. Then the accuracy may have the technical errors, so that errors also interfere with the saturation level. Then another important thing, that the person is obese. Then after that the extremities are cold, or the blood supply is decreased to that particular thumb or finger. So that also may give some errors in the reading. So that is the delimitations of the pulse oximeter. Now there are the various methods of giving this oxygen. Number one is through the nasal catheter. Number two is through the mask. Number three, a mask with the reservoir. Reservoir means a mask will have the O2 attached bag. Then number four is the oxygen hood. Number five, the endotracheal intubation, means we put a tube inside the trachea and we give the mechanical ventilation with the help of the umbo bag or through the ventilator. Number five, if we are not able to put the endotracheal tube, then we can do the tracheostomy. So these are some of the methods of the giving this oxygen to a person who is having the less O2 saturation. So this was the session regarding the ABC of the pulse oximeter. So I request all of you to subscribe my channel and press bell icon. So whatever the video I will upload, so you will come to know and you will take the benefit of that video. Thank you.